Below are things that can cause difficulty swallowing. 1. Sore throat. Can be due to viral causes or bacterial causes. When an abscess develops in the pharynx due to sore throat, swallowing becomes a problem. 2. Mouth infection. Mostly due to viral and fungal causes. Mouth infections is common in people with HIV. In case of a bacteria spread from a recently extracted tooth, spread can cause difficulty swallowing. 3. Infections in the neck, mostly due to a spread from somewhere else. In case an abscess develops, difficulty swallowing and neck pains can occur. 4. Enlargement of the neck lymph node. Because of these enlargement, compression of the esophagus occurs, causing difficulty swallowing. 5. Obstruction of superior vena cava, mostly due to tumors. These causes less blood returning to the heart from the head, neck and upper extremities. The patient presents with neck and face swelling, difficulty breathing and cough. 6. Either cancer in the head or the neck. Also, radiation treatment of cancers of head or neck causes difficulty swallowing accompanied with loss of taste and decreased tongue movements. 7. Tumor in the respiratory tract that has spread to the thorax. Compression of esophagus will cause difficult swallowing. 8. Cancer of esophagus. Common in people who smoke cigarette, excess alcohol intake and ingestion of thing that hurt the wall of esophagus, for example hot tea. 9. Stomach cancer. Common in people with low economic status. It is the third-ranged frequent cancer in the world. 10. Bacterial body infection. That has caused skin problems. Apart from difficulty swallowing, the patient experiences diarrhea, severe headache, joint pains and swollen lymph nodes. 11. Diphtheria. Not common problem since vaccination is available. 12. Tetanus. Caused by neurotoxins from Clostridium tetani. Vaccination is all that is needed to prevent infection. Since it is a disease that causes skeletal muscle spasm, involvement of the muscles of the pharynx causes difficult swallowing. 13. Ingestion of botulinum toxin. It causes nerve palsy. Involvement of cranial nerve can result in difficulty swallowing. 14. TB that involves the pharynx, larynx or epiglottis. 15. Inflammation of esophagus due to herpes simplex virus. Might be due to virus that has spread directly from the mouth or via nerves. 16. Poliovirus infection. Bulbar paralysis due to paralytic poliomyelitis can result in difficulty swallowing and changes in voice. 17. Chagas disease. Zoonotic disease that result in heart muscle problem. Chronic phase after years of infection can result in heart problems and gastrointestinal problems. 18. Eating meat with cysts trichinella. When larvae migrate, symptoms such as cough, breathing and difficulty of swallowing. 19. Congenital abnormalities of aorta. 20. Due to diseases such as hypertension, atherosclerosis, infective or trauma, abnormal dilatation of the blood vessel can occur. 21. Tear in the aortic artery. Common in men and affects people in their 60s and 70s. Compression of adjacent structures, for example esophagus, can cause difficulty swallowing. 22. Narrowing of the esophagus, mostly due to structural disorders. 23. Due to structural problem in the esophagus, a pouch can develop on the wall causing obstruction. When the pouch is filled with food, it enlarges, causing obstruction. 24. Failure of the lower sphincter of esophagus to open due to neuromuscular dysfunction, interfering of food emptying to the stomach. Mostly causes chest pain and heartburn. 25. Abnormal esophageal contraction. Patient mostly presents with difficulty swallowing and chest pain, mostly due to hyperactivity of the contraction. 26. Reflux of stomach content into the esophagus due to a defect in the lower sphincter of esophagus. Patient experience chest pain and persistent difficulty swallowing. It can cause inflammation of esophagus and even cancer. 27. Inflammation of the esophagus due to virus, fungal or radiation causes. 28. INF. Action of thyroid. It can be due to bacterial, fungal or viral. These cause inflammation of thyroid. 29. Tumor in the thyroid. 30. Low phosphate level results in neuromuscular manifestation that causes difficulty swallowing. 31. Bleeding in the brain due to hypertension. 32. Parkinson disease. Age-related nerve degeneration disease ranged second after Alzheimer's disease. 34. Disorders in the cranial nerve can also result in difficult swallowing. 35. Poisoning due to ingestion of aquatic organism that have accumulated toxins.